Hey guys, it's been a long time since I've done a video, and this video I decided to do one that has a little bit of update on my life, and then one that talks about my life as a dialysis nurse. So in this past July, I have been officially with the Fresenius Medical Care Company for 2 years, and I've been working as a dialysis nurse for 2 years as well. And all I can really say is that I love my job, and that's something I never thought I would really say. Well, do I really really love my job? But I can definitely tell you that I do enjoy being in dialysis. I enjoy being in this field, and the thought about doing something else is like, the more I work in dialysis, the further away I go from that thought. And that's something I would ever expect, and I think with some of my peers, they don't expect that either. And I worked really hard to get where I'm at right now. So I asked for a list of questions, and there's only two responses, but I didn't really give it that much time. But I think these are going to be the most common questions that people want to ask me about dialysis. And then there were more questions that have other people have asked me on the side, and I'm not going to show those questions to give them confidentiality to them, to keep them private from this video. So let me talk a little bit about myself. Like, if you haven't seen my videos before or seen me talk about myself before, no, again, I'm a dialysis nurse. I have hobbies on the side, and how I got here in 2020. December 2020 is when I graduated from nursing school, and then I have made a video about my experience with NCLEX. Like, yes, I did fail NCLEX once, and I had to take it twice, but I passed on my second time. That's something to be ashamed about, because honestly, I got that license. Here I am working in the field, and actually, I believe in this coming year I had to renew my license. So, and I actually have to put in the effort to get my CEUs, I believe. And I think the company also gives me CEUs. If they do, that'd be great. If not, can you please comment below of how you guys get your credit education, because I would like some advice on that on the down low. Anyways, going on for that. So to start with, so a lot of what I've also staff shortage is everywhere, burnout is everywhere, and like whenever my clinic was short staff, or like they want nurses, I have continuously reached out to my old college nursing group that is still active to this day, and I tell them like, hey, if anyone is going to be a graduate nurse and is interested in trying the dialysis field, we are looking for nurses. You don't need to have any prior experience. Training is provided for, and the number one thing that's usually advertised is that training is paid, and people like to be paid for the training they're being given, which is fair, because this is like they're saying you're having no experience, they're training for it. It's a thorough training, and they expect you to be competent in your training and be on your own. How long is the training? Well, that's one of the questions here. How's the schedule? How long is the training? Do you use your skills, and how? What have I enjoyed about it? And I know the number one questions people want to ask is about salary. And the thing is, I don't want to get too in depth about salaries, because I think that's a touchy subject. Not for me, but for a lot of people. And not only that, we live in a time where inflation is a thing, and some people might get paid more than others. It's just one of those things. It's just one of those, like, it's like a can of worms that I'm not willing to open, and not willing to touch with a 10-foot pole. Yeah. But going on back to myself, like, how I started. I want to talk a little, like, I want to take a couple minutes to talk about my journey in getting here. It's like I said, I went through school, I passed school, and I failed NCLEX the first time, and then I passed it the second time, as I said, and I got my license now. And I think what people want to know about, like, how did I get to dialysis, like how did I find out about dialysis and things like that. And when you go to interview, like, those are things they ask you about too. It's like, so how'd you find out about dialysis? And I was just like, I saw it once during clinicals and thought that was cool, and I really wanted a job. I didn't say those exact words, because I did say I have legitimately and truthfully seen it in during my clinicals one time and that was during my pediatric clinicals, surprisingly, because I was expecting it in a more like adult, like a med surge old adult to older adult setting, but it was in a pediatric clinical, and I thought it was still cool. I think this was like about I think it was my junior year. Yeah, this was in my junior year, so almost a year before I actually graduated. So they gave us a chance to see how someone was about to perform dialysis, and they let our group see what goes on. They pulled out this machine, and honestly, the dialysis machine they had in it at my pediatric clinical is completely different than the dialysis machines that I use in my clinic and every other clinic, which is kind of cool. So there are different there are different types of dialysis machines, but the main function is essentially the same. It's the same. It does the exact same thing. It may function differently in terms of, like, how do you set it up, how do you set the settings on the machine and things like that. But it's one of those learning curves, and like one of those, like, once you get a hang of it, you'll get it. But yeah, so like that was my first introduction in dialysis. And if I'm honest, like in school, at least in my personal experience, whenever we were learning about dialysis, they teach you about two things. Like, this is what dialysis is, this is what it does, this is for people who need dialysis and why they need it. And there's two kinds of dialysis. There's hemodialysis, which is blood related, and peritoneal dialysis, in which they use the stomach cavity, like that's within the stomach. All right, that there's two ways. Now, it's more common to see people be in hemodialysis first before they go into peritoneal dialysis. And in fact, in every dialysis company, they actually push for the if I recall, I believe they said they're actually pushing for more home dialysis. Now, home dialysis can either be for PD or HD, but most of the time whenever I say the home dialysis is for people who are on PD. And people who start in HD and hear about PD, they're mostly usually encouraged to go to PD, actually, and that's what they are pushing for, because it's actually cheaper and better, and PD is actually cheaper and better to do, because dialysis happens every day, whereas with hemodialysis, it's typically only done about 3 days a week in an outpatient setting. And that's something I need to also talk about, is that I am a dialysis nurse in an outpatient setting. I have never done an acute setting, and I have never been in a hospital. I have never been in a hospital for dialysis, or well, to like perform my job as a dialysis nurse. And even then, if you're interested in the acute setting, or you want to do dialysis in a hospital, they do have job positions for it. It's one of those, you simply apply. As for, do they give you training, or do they give you the training? Do they do this or that? I don't know. I don't know what they offer. I don't know. They give out bonuses, sign-on bonuses, and things like that. I can only tell you about my experience with Fresenius Medical Care. And I can tell you right now, like dialysis companies, there are many dialysis companies. Like the ones I know are Fresenius Medical Care, which is considered like one of the best dialysis company, and their typically competing company is DaVita, and then there's also US Renal, ARA, and Liberty. Those are at least the 5 I know. I have never worked with any other company but Fresenius, but I'm very comfortable with what I have and what I'm being given. Now, I'm not going to go into about like pros and cons of working for each company, or like tell you the things I heard like hearsay, because like they may or may not be true. And not only that, like these companies have many clinics throughout the nation. All right, this is countrywide. It's all over the place. Like in where I live alone, there's like apparently 3 dialysis clinics near where I live, and it's about 10 to 15 minutes away from me. And then like the more you branch out, the more you find. Like you'd be surprised how many dialysis clinics there actually are around, and each clinic has their own schedule and everything. So I can only, and so when it comes to scheduling, I can only speak for the clinics I have worked at. I have only worked for 2 clinics. I have only ever worked for 2 clinics, and they're both with Fresenius Kidney Care. So, but I have floated to other clinics before, and it more or less functions about the same. Like I said, I don't know how it works in DaVita. I don't know how it works in US Reno. I don't know how it works in ARA. I don't know how it works for Liberty. I don't know. I couldn't tell you. And I was told like I should try to branch out, but the more I work in dialysis, the more I work with Fresenius Medical Care. Like I've been like the idea of trying something else becomes like a far distant thought away, like fading away from my mind. And like I said, I'm comfortable and I worked very hard to get where I'm at today. So that's a little bit about the background story. And like I said, I have tried to apply for residencies and things like that. It's like I just didn't get a call back, and I was just getting nowhere, and I was just getting to the point of I need a job. Like I just want to work. So that's how it went. Like dialysis was just something I remembered hearing about during my clinicals, and here I am. And I applied to different companies as well. Fresenius just happened to be the first one to reach out back to me, and here I am. It just happened that way, because I could have, like, DaVita could have called back to me, and I could have just been, for all, like, maybe in some other universe, I could be talking about DaVita instead of Fresenius. Food for thought. But yeah, so I was just applying to things. Infusion clinics is what I try to apply to. I also try to apply to like rehabilitation centers and things like that. And they never got back to me, by the way. None of them except for diet. It was just so interesting because only the dialysis physicians called back to me, and I almost instantly accepted the Fresenius one, because everything, when I was talking to my recruiter and I was talking to the manager that was trying to hire, I was trying to get hired by, like, they had everything like I thought I could negotiate the best out of, and here I am. Alright, so I'm going to try to go ahead and get into, like, these questions. I already talked a little bit about, so I already answered kind of some of these questions. That very last question, is the salary or pay competitive, and do they give decent raises as you progress? I am going to try my best to answer that question without going into, going too deep and in depth with it, because when it comes about pay and salaries, I personally think that's a touchy subject. I personally don't care. But I don't think the company would appreciate me talking about it. And not only that, anyone who's a clinical manager or a director of operations, I don't know how it works, and I'm only trying to get my experience, but I do know that's just a can of worms that you just do not want to open for sure, and want to stay away with a 10-foot pole. Alright, so let's go ahead and see the first question. So the most common question I do get is the scheduling. So typically, like I said, scheduling is actually different between clinic to clinic, because here's why. So some clinics within Fresenius, actually, they may only, so there's a thing called shifts, and it's there is technically considered a morning and night shift, but the thing with the morning and night shift, that only exists when there's 3 shifts. And basically what these shifts are basically a set of patients in each shift. So there's a set of patients in first shift, second shift, and third shift, and this is supposed to span throughout the day. And the first shift typically goes with the morning patients. The second shift are mid-morning to mid-afternoon patients, and then third shift is typically from mid-afternoon to evening. And this is where the divide of morning and night shifts are, and it gets confusing as I talk about it. And like I said, I'm gonna not go in too much in depth about it. And not only that, when it comes to the shifts, every clinic has different chairs, meaning they have different number of patients that they have per shift. So for example, the clinic that I started with, they had 30 chairs, and that's 30 patients, meaning every shift we had at least not bare minimum, but we can hold up to a maximum of 30 patients at a time. So we had 30 patients per shift, 30 patients second shift, 30 patients third shift. Now that may not always be true, because like there's, first shift, like, oh, it's 30 patients, second shift maybe like 25 patients, and then and then the third shift, which is typically your evening shift, they may only have like 10 people, on that shift. All right. That is all I can tell you about that. And like I said, not every clinic is the same. Some clinic may only have 2 shifts, and some clinics may have 3 shifts. My first clinic, they have 3 shifts. And there's 2 different kinds of schedules. There's a Monday, Wednesday, Friday schedule, and a Tuesday, Thursday, Saturday schedule. That isn't to say you're stuck with one schedule. They will mix and match your schedule. Like sometimes you work Mondays, Tuesdays, blah blah blah. It's like, any, like, the hours are set too. So like anything, so your days are mixed up. You get days off, but you will work at least up to 40 hours. And it is possible to do overtime, but it's the same everywhere. Like overtime is generally discouraged because they don't want to pay people. I'm sorry, what? But yeah, this is a good thing that I work between 2 clinics. So, and I also want to add that I have floated to other clinics before. So I have worked in other clinics before, not permanently. Most of the time that I floated to other clinics, it's usually to help those clinics out because they are short staffed, actually. And some I volunteer. The only time I ever like voluntary pick up shifts are with my old clinic, because they do have a soft spot in my heart, because that's where I started, and that's my humble origins. And I did I love my staff there, and yeah. So, for example, like at my old clinic, they offer. The thing is, they offer. They did offer 6-hour, 8-hour, 12-hour, and 16-hour shifts. And the way when I started, I was working 5 days a week, 8 and 12-hour shifts. And Sundays, this is the same throughout all dialysis clinics, but Sundays are the guaranteed days off. Like dialysis clinics are not open on Sundays. They are closed on Sundays. There are special occasions where you are working on Sundays, and it's typically for the holidays. And it kind of changes every year and I think it's also up to clinic discretion whether they want to work that Sunday, and it does it in terms of holidays. There has been like emergencies where we close up for a day and we open up Sunday, and this is usually due to inclement weather or something happened at the clinic. It just really depends on the situation, and how bad the situation is. But yeah, so my old schedule was that I worked 5 days a week, and I was doing both 8-hour and 12-hour shifts. I have done 16-hour shifts, and they're long and they're not particularly hard. And how I describe about working in dialysis is very repetitive. Like you do the same thing every single day, and that's something that I really like. And not only that, I've always enjoyed having like a one-on-one, a little bit more personal connection with my professional and personal relationship with my patients. And these are patients you see like almost every day, 3 times a week on 2 different schedules: the Monday, Wednesday, Friday schedule and the Tuesday, Thursday, Saturday schedule. And so like I got to know these patients one-on-one. I see them like literally every day, and when they leave, move move on, I do get sad about it, because I've seen it for so long and can't believe they're leaving, things like that. And yeah, and as patients goes, you always get new patients, and they can either be for short term or long term. It's always the scenario is always different for every patient, because you'll hear patients being like, oh, I've been here for 2 years, 3 years, 10 years, and things like that. And it's interesting, the kind of stories that you hear from these patients too. And as for like how old, I think some people ask me like how old are these patients typically, and honestly, dialysis can happen like to anybody at any age, from like young adult to like elderly. All right, it can happen. Like it can happen to anyone at any age, and dialysis has been done for children as well who have kidney failure. There are children who have kidney failure as well. But personally, like if I'm honest, like I haven't I don't think I can talk about that actually, so I'm not gonna do it. But that's just something to know that dialysis it happens across all ages and all lifespans and everything. Right. But going back to the schedule, yeah. So that gives me an idea. And like if I talk about my schedule now, is, so like I said, the clinic I work now only has 2 shifts. So which means I actually only work 10-hour days. And before I was working 5 days a week. Now I'm only working 3 to 4 days a week, meaning I get 2 or 3 days off every week. And sometimes I want a little overtime, so I'm willing to pick up more shifts at other clinics or asking my coworkers, "Hey, can I work for you this day?" And most of the time, they're more than happy. They're more than happy to let me work their shift. Most of the time, unless they want their hours too, then that's a problem in of itself. But yeah, like I'm not complaining about my new work schedule. Like I thoroughly enjoy it. The 10-hour shifts, and so basically my 10 hours just like, so we open at 5 o'clock, work from 5 to 5, basically. It's pretty good. And there are chances where like you could go home early, and it's based on patient census, and that's a whole other thing that I will not get into. All right, that if you want to know the whole thing about patient census, like that's a video in of itself. I'm telling you. But yeah. That's really all I can talk about scheduling, because in my opinion, I think the scheduling is pretty flexible in dialysis. Now I know I talked about like I work like 5 days a week in my old clinic, but like it's another thing to understand. It was a big clinic, and you think about it, if I was working 8-hour shifts, then that makes sense if I was working the 5 days a week. And my days off, like it may not be. It's people will assume it's Saturdays. No, like it could have been on a Monday, Tuesday, Wednesday, Thursday, Friday. I had days off on all over the week. And like I said, and like sometimes I have gotten 2 days off as well, because if I'm scheduled for 12-hour shifts, or they ask me, usually when I do 16-hour shifts, they have to ask me if I want to do a 16-hour shifts, and most of the time I usually say yes to doing a 16-hour shifts, on of course the condition I get a day off the next day, or you give me an extra day off, because I'm pretty sure that puts me at the 40-hour mark. And by law and legally, they cannot be making you do work more than 40 hours, of course, unless you do it by choice, and at that point it's just personal overtime. But yeah. So it's so if you plan to be in dialysis at a clinic and you're wondering about the schedule, like just ask the manager, because they are the ones who make the schedule, and they will work with, like they will try to be flexible with you as much as they can, but they have to consider their other staff as well. All right, next question. How long is training? Okay, so I can only talk about for Fresenius Kidney Care, FMC. The training is 12 weeks, 12 to 13 weeks, so that's about 3 months. You get about 3 months worth of training. So, and like I said, you don't have to have experience in dialysis. All right. This 3 months of training is them teaching you what is dialysis, and they literally teach you from like the base ground. Like they give you the basics of biology to like the machinery, to certain terms, like they go basic with you, and then they ease you into it, and you do get hands-on experience, and you get the hands-on you get the hands-on experience, and like the clinical experience as well. Like you actually get to do things on site at the clinic that you're going to be training at, and they do have training sites as well if they can if they tell you if you're unable to do it at the clinic that you want to be hired at. Training, and so there are preceptors. So I would say the most interesting thing is like my preceptor is a CCHT, so they're a certified dialysis technician, right? That is what CCHTs are. most of the time, they're like expert cannulators and things like that, and they are your best friend in understanding the patients, especially when you're new. And I had a really good preceptor. I thoroughly enjoyed my training, and I keep asking him, so like, was there ever a time like you ever got like annoyed with me, or like you were upset with me? And there was only one time. And but other than that one time, he said like I was one of like his best students ever, and like that made me really happy, and I felt good about myself. And like I said, I didn't realize I had a knack for dialysis. Like I didn't know like dialysis would be my passion, and here I am. Dialysis is my passion. And another thing about the 3 months of training, like use that training to gauge, use those 3 months to gauge if this is where you want to stay. Do you see yourself doing this every single day? Do you see yourself doing this long term? Or is this something you just want to try out? Like, if you think this is just something you want to try out, those 3 months are the way to do it. And if you feel like you still need a little bit more 3 months, then there's something wrong with that. I would say, they say if you can last dialysis after 6 months and then 2 years, like dialysis is it for you. That's what I've heard. I don't know the truth of that. Next question is, do you use your skills and how? Okay, I really didn't understand this question. It's not that I didn't understand the question. I think they're talking about like nursing skills and things like that. And the thing is, like this, dialysis is a specialized field, and I would say like, well, a lot of like nursing judgment is a big thing in dialysis for sure. I would say like. And there is no right or wrong answer to everything, and then it's just and when patients are asymptomatic, it's just when you're using nursing judgment, there are certain things you just have to call the doctor for, and there's just certain things like sometimes it's considered their norm. And I feel like when it comes to dialysis, it's all about oh, excuse me, I don't know what the heck that was, but it's all about knowing your patients, especially, and when you're new, you don't know the patient, like, you don't know these patients, like, you literally don't know the patients, and you're building your rapport with them from the ground up. But the more you work with them, the more you get to know them, and so, like, you eventually get that foundation. And then, honestly, I learned a lot more new skills in dialysis, and I feel like it's not that I can't explain how I use them. It's one of those, like, you have to experience it yourself, or not, or I have to show you. Like, you have to be with me, you have to shadow me, and I have to explain it that way. That's just how I am. If other people can, if you would like to ask this question again to me, feel free to leave a comment below, and I'll try my best to talk about it. What have I enjoyed about dialysis? I love my coworkers. They're funny. Look, I think, I guess for me, like, my coworkers are probably the best thing about dialysis. It's just because, like, you're doing the same, like, I'm telling you, dialysis is a very repetitive and routine thing. There's nothing wrong with that, but my patients and my coworkers definitely make my day. In dialysis, it doesn't get monotonous at all to me, and I feel like if we just treat it as a job, just to get paid, just to get in and out, like, I think I would be more miserable, because that is not how I can, I don't think I could go through a job like that. That's for sure. In dialysis, like, I do a lot of cannulation, and in terms of the state of Texas, like, nurses are the only one that are allowed to do the catheters to do dialysis for patients. In other states, they do allow PCTs to do catheters, but as far as I know, Texas is one of the few states, Texas is one of the states that says that nurses are the only ones that are allowed to touch, like, the catheters, pretty much. But yeah, I'm not going to spend too much on that question about what I enjoy about it. It's just, I really like the job. It's repetitive, it's routine, and if I had to compare, like, if I need to compare like the workload between dialysis and being in a hospital, like, this is my biased opinion. Like, well, the thing is, like, actually, I'm not even gonna state my biased opinion because I think that's just gonna open like a can of worms in of itself too. All right, I'm gonna answer this last question: is the salary or pay competitive, and do they give decent raises as you progress? I will tell you this. I was told like they do give you yearly raises based on your performance every year, and like every year that you work with your clinic and your manager. And of course, like you should, and this is the same with any job at any workplace. You should be doing your best. You should be showing like you're going above and beyond to show like you love your job, like you're doing the best you can in your job. And like if anything, if they see your work ethic, like I say it'll pay off. I don't think the pay and the salary is competitive in my opinion, but if you are like I say, if you're an experienced nurse and you think your skill set as an experienced nurse can help you negotiate your pay when you first get recruited by the recruiter and you're talking to the manager, I mean, feel free to try to negotiate your pay. Is all I can say. Like I said, there's nothing I really want to talk about, not want to talk about, but rather what I can talk about without, like getting into something that it shouldn't be. And I know a lot of people probably expect me to talk about like benefits, and it's like, when it comes to benefits, I don't think I can really leak that kind of information out in this video, but I'm more than welcome to try to talk about it like in a one-on-one kind of thing. Feel free to message me in my DMs, and I'm more than willing to share about like what I think about the benefits and things like that. Only that it filters. Oh, like I think that was another response someone put in. Like they just all they really understand what dialysis is. I mean, it's not wrong. Like, yeah, like that is what dialysis is. It filters blood. Like I'm not saying they're stupid or anything. Like no, that's really all dialysis is. You're just cleaning the patient's blood. Yeah. And I think a lot of people like to one of the most common questions, not in this form, but some of the common questions people ask is like, how does dialysis work? And like I said, it is doing dialysis at the hospital is completely different doing it an outpatient, because there's like, we actually have more restrictions on what we can do, I say, in an outpatient compared to what they can do in an inpatient, and so in a hospital setting. But typically, like, patients run a set amount. So dialysis treatments are prescribed by a doctor. So they run a set amount of hours on the machine, and every 30 minutes we get vital, and every 30 minutes we get the vitals, make sure everything's flowing good for those, like, for that set amount of time. The average I've seen is about 4 hours, but there are dialysis, like dialysis where it goes for overnight. There's overnight is nocturnal. And PD is meant to be every day. The idea about PD is being able to do it every day, and you can do it at shorter intervals is what it is. Whereas with hemo, typically though, it's like 3 times a week, longer hours sort of thing, and you have to be coming consistently. And a lot of I said, going back to like the skills things, like I say there's a lot of education. Like when it comes to working in dialysis, there's a lot of educations. I say knowing your labs is good, and your nursing judgment, assessment and things like that. And most of the time, it's really more focused assessments, and when compared to head to toe assessments that they teach you in nursing school, because the way to see a patient's like fluid volume is really their physical appearance, and not only that, when you take vitals from them, it's like you can tell when they're fluid overloaded. And I'm telling you, number one treatment is typically dialysis. And dialysis is hard for patients, especially because it's a whole lifestyle change. to their home, and especially to their diet. Like a lot of things that they can't eat anymore. They have to be super careful when they're on dialysis now, and and there's really no cure to diet. So like kidney disease or kidney failure, I should say. And the only real cure is like getting a transplant almost. And but I've heard a lot of good things about people getting transplants. So I think that's it for my video. I'm sorry I ran kind of long, and I like to ramble a lot, so I'm sorry you guys didn't like me rambling. And I go on tangents, and sorry, and if I tend to devolve from here and there, my bad. But if there's any more questions, I'm more than happy to answer it. You're welcome to send me a message or leave a comment below. And I'll see you guys around next time.